my name is Megan Cray. I'm going to be your student nurse today. I'm going to wash my hands. Okay, can you tell me your name and date of birth?
Amanda Foley, 2/27/93.
Great. Do you know our current president?
Donald Trump,
The year?
2020.
Where you are today?
In a nursing home.
And the season?
It is fall.
Okay, a patient is alert and oriented, times 4. Do you have any questions for the doctor today? Concerns?
No.
Have you been having any numbness or tingling? No. Okay. Any headaches recently? No. Dizziness?
No.
No. Okay. I'm gonna check your scalp if you don't mind. I'm gonna check patient's scalp for any bumps or lesions. Okay, scalp is free of any bumps or lesions. Have you been having any difficulty seeing lately? No? Okay. I'm going to check your eyes. I'm going to just shine a light in them, okay? Okay. The scleras are white and the conjunctiva is pink. There is no drainage. Can you follow my pen light for me? Okay. We have positive perla and the patient is accommodating to light. Okay, can I check your nose? Can you breathe in for me? I'm blocking one side of each nostril to test the patency. Breathe in. Okay. Moist, there is no drainage. The lips are moist. Can you open your mouth for me? Okay. Mouth is pink and moist. There are no lesions. Can you move your tongue left and right? Mm-hmm. Great. Can you close your mouth and smile? Frown. And puff out your cheeks. Great. Next, I'm going to palpate the pinna of the ear and pull back and up. Tympanic membrane, there is no drainage. I'm going to do the same to the other side. And no drainage. The ears are equal in placement. Next, I'm going to palpate the lymph nodes in a circular motion. Just checking for any swelling. Okay, great. Now I'm going to assess to make sure the trachea is midline by palpating. Okay, great. The trachea is midline. Now I'm going to assess the temporal artery, which is equal in bounding bilaterally. And at this time, I'll assess the carotid artery one at a time. Okay, great. Do you mind sitting up for me? At this point, I'm going to have the patient sit up to assess for any JVD, jugular vein distension. Do you mind looking at the right for me? Okay. And the left, we have no signs of JVD. Now I'm going to pinch at the clavicle, and I'm just checking for skin turgor, which is instant recoil. Okay. And the skin is dry, warm to touch, not moist. I am going to now assess the heart sounds, starting at the second intercostal space on the right, listening to the aortic valve. Next, I'm going to move to the second intercostal space on the left, listening for the pulmonic valve. Now I will be moving to Erb's point, which is the third intercostal space. Next, I'm going to move to the tricuspid valve, fourth intercostal space. And this is where I'll hear S1 and S2, lub-dub. Next, I'm going to move to the midclavicular line, fifth intercostal space for the mitral valve, the apex of the heart. I will assess this for 1 full minute. Okay, there's no dysarrhythmias. The heart sounds sound regular. Okay, have you been having any shortness of breath? Difficulty breathing?
No.
No? Okay. Have you had a cough lately?
No.
No? Okay. Now I'm going to assess her lung sounds anteriorly and posteriorly. Can you take a deep breath in? Okay. 1 on that side. 2. Deep breath in. 3. Deep breath in. 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 And deep breath in. Great. Now I'm going to listen in the back. Deep breath in. Deep breath in. Deep breath in. Deep breath in. And again. 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 One last time. Okay. Lung sounds are clear throughout. We have no signs of wheezing or anything like that. You may lay back down a bit. Oh, I'm just actually, while you're standing, can I just check your gait? Perfect. Patient is strong, no weak gait. Do you feel any dizziness?
No.
No numbness, tingling?
No.
Great. You can lay back down. Thank you. Okay, do you know when your last bowel movement was?
This morning.
Was it formed, soft?
It was formed.
Have you
solid.
been having any diarrhea?
No.
Any constipation?
Nope.
No? Okay. Any vomiting, nausea?
No.
No? Okay. I'm going to assess the abdomen, and her abdomen is flat, non-distended. Next, I'm going to auscultate bowel sounds, starting in the lower right quadrant. Upper left and lower left. Okay, bowel sounds are active in all 4 quadrants. Okay, next I'm going to palpate to see if there's any tenderness. Does that bother you at all?
No.
Okay. Soft abdomen. Great. Have you been having any difficulties urinating?
No.
Is it clear, cloudy, yellow?
It was almost clear.
Clear? Great. Does it burn when you
No.
go? No? Okay. Now I'm going to assess the radial pulse bilaterally. Okay, equal and bounding. And the brachial artery, which is also equal and bounding. Great. Next, I'm going to have you push up on my hands and push down. Just checking the patient's strength. Can you squeeze my fingers for me? Which is bilaterally equal. Okay, now we're going to check range of motion with your wrist and your elbows, shoulders. I'm going to have you go out, back in, other side, checking your wrist, elbow, shoulder, go out. Upper extremities have full range of motion, bilaterally equal. Okay, if I were to, I could assess the femoral artery. Now I'm going to assess the popliteal artery, which is equal and bounding. The tubularis, also equal and bounding. And the pedal pulse, equal and bounding. I can now check for any edema just by pushing down, and we have no edema. Next, I'm going to check the capillary refill on all 10 fingers and 10 toes. And it's instant capillary refill, bilaterally equal, and there's no signs of clubbing. 10 toes as well, which is bilaterally equal and strong. Can you just push down on my hands for me? Okay, and up. Great. I'm going to check the ankles for range of motion, knees. We're going to check your hips. Turn out for me. Great. Other side, ankle, knees. Turn out for me. Great. We have full range of motion in her lower extremities, and the lower extremity strength is equal. We have a strong gait, and if the patient was in a Johnny, I would check for any skin lesions, any breakdown of the coccyx, or any of the bony prominences, and that's it.